Congressman Michael Burgess here. It is Friday morning, a little after 9 o'clock Eastern Daylight Time in Washington, D.C. on the 17th of July. This is the day that we're going to start working on the health care bill in my committee, Committee of Energy and Commerce. We're going to begin working on it in earnest. Now, yesterday we had a full day, but we just had opening statements. That's where we all get to talk, but not much happens. Here's the bill. This is the second iteration of the bill. This is a little over 1,000 pages, 1,026 pages to be precise. And for those who are interested, yes, I have read the bill. In fact, I was so upset about some of the things I saw in the bill that I prepared 50 amendments to be introduced in committee over the next several days, 50 amendments to either point out things that are glaring deficiencies or even just outright travesties that are in this bill. And yes, some of these amendments would seek to improve the bill. Certainly, one of the things that I've worked on, we're going to expand Medicaid by a great deal in this bill. Well, if it's such a good program, maybe members of Congress ought to have Medicaid as their primary health insurance. There's a lot of good ideas contained in here. This is something that's been important to me for literally all of my life, the health care of our nation's folks. And never once was I asked to participate in the writing of this bill. Now, for the next 3 or 4 days, I'll get to participate in what's called the markup of the bill in committee. That's why I'm prepared. This is really the product of about 2 or 3 weeks' work. And again, you have to have copies of amendments for everyone who sits on the committee, so we're ready to go. We're not going to be shut down by a technicality. We're not going to have the chairman say the amendment wasn't there in time. All of these have been filed with the committee. The good news is they've had to read all of my amendments. In addition to me having to read their bill, they've had to read my amendments as well. We'll start out today. I'll update you periodically. It's going to be a brutal process between now and early next Thursday morning when this will come to a conclusion on our side, and then the following week we'll have it on the House floor. So I'll update you periodically. It's going to be quite a spectacle. It's going to be quite a sight to see. Interestingly enough, I do not think they have complete unanimity on their side about the favorable reporting of the bill. There are at least 7 Democrats who have been identified as perhaps not in favor of the bill. Our side has been pretty much unified that they are not going to support the language that's in this bill today. So keep an eye on us. You know, we'll do. You never know what we'll do if you're not watching, and let your members of Congress hear from you, because this time it's important. This time it counts. Thanks.